it goes on and on. This is the beauty of DLD. I have the pleasure to, after this amazing talks with Anne and Kara, about personal genomics and the outcome of personalized healthcare, we are now opening the scope a little bit wider. Rethinking the Future of Science is the title of our next session. The pandemic has become an extraordinary catalyst for technological change. We all know this. As the need for innovation is greater than ever, what are the key learnings and which technologies will shape our future? Please welcome our panel of experts. With me in the studio is Stefan Oschmann, Chairman of the Executive Board and CEO of Merck. Stefan spoke at DLD several times since 2008. Remember, 2008, 12 years ago, 13 years ago, and has always brought cutting-edge know-how to the community. I always learned from him. He will be joined remotely by DLD newbie Pardis Sabeti. She's professor at the Harvard University, the Harvard School of Public Health, the Broad Institute of Harvard and MIT, where she leads the computational genomic labs aiming for detecting, containing, and treating deadly infectious diseases. As you know me, dear audience, I was very happy when I read about Pardis that she's also a rock singer. I'm looking forward, Pardis, to have you in concert here in Munich at one of the next DLDs. The session will be moderated by Sara Weber, Managing Editor, DACG, whatever it is, and Benelux of LinkedIn News. Thank you for joining this. Thank you, Stefan, for bringing it together. We are looking forward to your discussion.
Thank you, Stefan.
Hi, everybody. Thanks so much, Steffi. Really appreciate you bringing us here together in studio and across the world, basically. And we want to talk about what the pandemic has done and also what the future looks like. And to kick things off, Pardis, you've been on the forefront of fighting pandemics, both Ebola and COVID. And we had a little prep call earlier, and you showed a simulation there, which we all found super fascinating, about how a virus spreads on a college campus. Could you show that to us and also explain a little how a tool like that could help with future pandemic response?
Yeah, sure. I'd be happy to. I'm sharing my screen right now. So thanks so much for the opportunity to be here. I'm really excited to be here. And over the last decade, my group has developed a series of tools to both based on genomics and information technology to combat infectious diseases. And one of them here that I'm showing you is actually interesting. We've been developing apps to use Bluetooth and other measures to track outbreaks. We also developed an app that can simulate a virtual virus spread using Bluetooth on folks' cell phones. So this is a college in Colorado we were working with called Colorado Mesa. And over Halloween weekend, they chose to participate in this virtual viral outbreak to see how a virus might spread with all of the epidemiological features of SARS-CoV-2. And so you can see, this is Halloween weekend. So it was a time when we thought the students might interact. We were a little surprised as to how much that these individuals would download an app, put it on their phones and interact this much, but very, very telling. And actually by the time, so this is, you can see this is Friday, October 30th. And by November 1st, there was a real outbreak on campus. And this data really gets us to have an opportunity to see how that all tracks together. And at the same time that we're running these tools and teaching the community a way of understanding what's going on and trying to get them to participate in using our tools for contact tracing and beyond, we also have developed these tools and technologies to let them see real outbreaks. So this is anonymized data, but this is we have this real data on this same campus, and you can see basically where cases are being identified and information about those cases. You can click on a particular dorm and you can see actually where those individuals are in the dorm base, and you can click on here, I said anonymized Emma Thomas, and you can see she's on the swim team and there are 3 cases on the swim team. So it's actually like building tools both to teach and to allow everyone to be able to take public health more in their own hands and see this at a high level.
I thought this was super fascinating, just looking how people moved and where the outbreaks might potentially start, like the swimming team. Seems quite suspicious in this. Stefan, looking back, do you think we were prepared enough for COVID hitting? And as the answer is probably no, what do we need to do in the future to actually have a stronger response and stronger response mechanisms in place? Stefan, do you
Yes, Sara.
hear us?
Well,
Okay.
we were obviously not well enough prepared. I mean, this is sort of commonplace knowledge. Finger pointing doesn't help in this situation. There are very few countries that had really gotten their act together. It was not that experts had not warned. You know, many scientific experts, people within the political community and so on, had been talking, discussing, had been making suggestions. This outbreak right now, this pandemic, is very bad. We all know that, but we all know that it could have been much worse. It could have been a pathogen with a much higher lethality. And I'm an eternal optimist. I hope that the world community is learning out of that, and we're seeing so much progress. We just had a session prior to that about digital solutions in health, telemedicine, etc. I think we're going to see major change in this in this respect. I personally focus a lot on therapeutics and on vaccines. I believe that the developments with regard to mRNA vaccines are really a watershed moment in science. There are serious efforts in the United States, in Asian countries, in the Middle East, and in Europe to set up an infrastructure so that we can be very agile and rapidly respond to novel threats. So as bad as this situation is, I think it will bring about a lot of positive change going forward so that we are more prepared and that our healthcare systems will be more resilient.
So that we really learn from this basically going forward.
Yeah.
Pardis, you're nodding. Anything you want to add here?
Yeah, no, I mean, I think, you know, absolutely right. Like this is such an important moment to take and to galvanize. It's the idea of never letting a crisis go to waste. It's awful what's going on here, but Stefan is absolutely correct about the fact that this could have been a much worse virus. It also still can become a much worse virus. As you know, viruses are constantly mutating and changing, and people are becoming more aware of that. But it's one of those things where we can never slow down because we know those things can change so much.
And by the way, Pardis was one of those who had been warning, who had been raising her voice. Pardis had received a prize in 2019 on pandemic preparedness, the Merck Future Insight Prize. There was so much discussions. I remember we had plenty of sessions at the Munich Security Conference since 5-6 years because we wanted to alert the security community to. But it's difficult to be a politician. You know, people are being forced into all sorts of things, and I think a discussion about who did wrong or who didn't do this job or so is not meaningful. We need to focus on solving these problems.
How is an outbreak and a virus like this different from other existential threats? You just mentioned the Sicherheitskonferenz Munich, where basically threat assessment is a huge part. But how is this now, what we're seeing, different from other things that might be threatening humanity? Pardis, can you share some examples?
Yeah, sure. So often when I want to take a moment and thank Stefan and Merck because they were very prescient and had awarded this Merck Future Insight Prize towards individuals to try to tackle emergent infectious threats. And then a year later, we had that emergent infectious threats. I think this past year they did antibiotic resistance. I don't want them to be too prescient. So hopefully we don't have another crisis on our hands. But it is a collective force of people have been talking about the need for this for some time. And I think when I describe what's unique about outbreaks amongst existential threats, I kind of point to three things. The first is just the unbelievable toll, both life loss and economic loss that you see, right? So we're talking about over 2 million deaths here from COVID, trillions of, we're talking about costs in economic loss in the trillions. You know, and you can, and the same thing where we saw with Spanish flu, that infectious diseases cause more personal and economic loss than you know, most anything. And the fraction of what you need to do to respond to it is just, what you need to do to respond to it is a fraction of the cost of one of these events when they occur. But also, so that's sort of the first thing, right? Just what the magnitude of the threat. But then the second thing is just that, unlike some other existential threats, what you need to do to respond and think about stopping a virus like COVID is what you need to do to respond to malaria every year, to just the thing that's affecting your child in daycare or making you sick in the office, right? That the tools we need are very routine, and you get a payoff right away. You're not creating something for a potential future threat. Every year, there is morbidity and mortality from infectious diseases that could be mitigated by these same tools. So there's just no reason not to invest. It's not even an insurance policy. It is immediately, actively important. And then the third thing that kind of frames a lot of how we think about it is, unlike other major things we try to get every citizen to care about, like voting in the United States, which is very hard to convince, particularly with our electoral college, or recycling, when what does my one can of Coke do for the whole ecosystem? In infectious disease, one person can launch a pandemic, and therefore one person can stop it, right? With the exponential spread of viruses, every single person in that ecosystem matters, and it immediately becomes a problem in Honduras, can be a problem in in Boston tomorrow. And so we're very connected, and every single person matters. And so when we think about it, it is about giving a lot of agency and empowerment and trust in the whole ecosystem.
When you talk about the things we can do to mitigate it, you're talking about very simple things, right? Just to clarify, like the hand washing and mask wearing and the things we've now grown so accustomed to, but it's not actually even the big things, right?
Yeah, well, I'm also talking, so there's those kinds of things we can think about, like don't sneeze in your hands. And I mean, it's amazing what we used to do before COVID, right? How comfortable people would be coming into the office, like sick, coughing on you. But yeah, so those things are the simple things that each individual can do. But there's more we can do about that, sort of thinking about contact tracing, like telling people, hey, I'm sick, you might want to know this. And also just better diagnostics. All of those things of just getting that information, so that both the tools and the technologies and the way we behave, all of those have relevance on a larger scale, and every person can have more agency than we currently give them.
Let's talk a bit about technology, and especially when we look at the past couple of months, like if we look back about a year, like I think nobody would have thought that we by now would have had several vaccines that are being administered, that we have built so many new technologies and used them in a way we didn't even think about previously. mRNA is one of these, which is now part of our vaccine efforts. And that change has been accelerating super quickly. Where do you think are the most interesting technologies coming up? And also, will they still have an impact, like when we're done, hopefully, with this pandemic specifically? Like, how will we still be able to use them going forward?
Sara,
Stefan, do you want to kick us off on this?
Yeah, I can share a couple of thoughts on this. We're basically going through a real life digital living experiment right now. And it's amazing that things work despite all these difficulties and despite all the suffering and so on. But things work, supply chains work, research work. Nobody would have thought that this was possible, and this is a catalyst for major change. And if you look more practically, let's say, if you look at the situation in Israel, the cooperation between the Israeli government, between major sick funds such as Clalit and companies like Pfizer and BioNTech, the data we're getting out of that, it's absolutely amazing. We have a revolution in what we call real-world evidence data. That will change a lot many things. We've seen that the regulatory bodies, institutions like the FDA or the European Medicines Agency are changing. They're doing real-time reviews of new technologies. This is really big. I personally have an obsession with biotech. This is sort of my my life. And you mentioned the mRNA technology, and that is in a way almost a digital technology too. And I have an obsession with the semiconductor technology, and I see a lot of change happening there, because everybody thinks that such formats like now are only made possible because of software. Hardware is actually the most important factor, and we're seeing a revolution in hardware development through neuromorphic computing, through quantum computing, and many other areas. So my assessment is that this crisis, as bad as it is, we will be able to manage that through science and technology, and it will give us a boost so that we can tackle other challenges that we have in front of us, such as climate change, with novel technologies.
Talking about mRNA, can you elaborate a bit on that? Because I feel it's one thing where a lot of people have heard a lot about it, but not necessarily everybody knows exactly what it means and why it's such a big deal.
Was that for Pardis or for me?
Whoever wants to take it.
Pardis, you're the real scientist, why don't you?
I think, essentially there's been a range of new vaccine technologies, and ultimately I think Stefan is, and by the way, Stefan, I'm getting distracted, but amused and charmed by the background that's moving all the time. So I love it, all the pretty images behind you. But I would say for MR, so there's a lot of interest right now in the just completely changing the game. There's a lot of breakthrough, radically transformative technologies, both in the diagnostic space, in the therapy space, in the vaccine space. And one of them is this idea of DNA and RNA vaccines. And so this is taking the sequence of the virus itself and finding a way to introduce that into our system. There's a way that you can basically introduce the RNA of the virus. It's just like it's a genomic sequence. It's a kind of a code that you have. You can introduce it and get our own body to start displaying the virus's protein to our immune system. What's great about it is if you have a new threat that you're looking at, you can immediately just change the code and introduce a new one. So if a new virus came in, we could quickly modify the code and now introduce something else for our immune system to respond to. So that's really kind of what's really exciting about it. And that kind of technology, mRNA, is very easy to deliver relative to other things that you're trying to deliver into your system to take a look at. So there's a feel that it can be very safe and easily given to a lot of people. But I think the big transformation in it is just how fast we are able to develop a new vaccine. And that will only get faster because most of the time we took up till now was just saying we've never used this type of technology before. And it's amazing to see that kind of high level of efficacy. But in the future, it is a very big tool in our arsenal to find that when we find a new viral threat, we could immediately start developing a vaccine in short order.
I think
Did that answer the
mRNA has
question?
already revolutionized vaccine technology. It took in the past, I don't know, sometimes 20 years, 10 years or so until from when a virus or a pathogen was detected until we had a vaccine. Now we had this within months, and the technology is so versatile. So when new variants, mutants come up, it is not so difficult with a relatively limited clinical program to develop a novel vaccine against new mutants. But what I believe is that mRNA is also going to revolutionize the rest of biologics in cancer, in immunological disease, etc. I also think that it will be possible to use mRNA to express antibodies directly in humans, not the antigen, so that the body produces the antibodies, but to code antibodies directly, and that I'm very, very curious to see how progress is going to happen in this space.
I think with tech, we've really seen how well it has worked and how quickly it has shifted. On the other hand, we have seen that COVID has shown us some cracks we have in our society, right? And how the way we communicate, how we collaborate. And this is still something we need to figure out for this crisis, but also for the next crisis. How do you think can we use technologies and platforms to learn from the situation and to make sure we have a better system in place for whatever is happening next?
Yeah. Do you want me to take it? So yeah. I mean, I think that, so, what this outbreak has essentially shown that, the tech has really shown the transformative nature of technologies, from detecting outbreaks and track and trace modes to the vaccines that we develop, to also the technologies and the way we live, from all of the different video conferencing technologies that we have, or ways that we're sharing our data. There's been so many innovations just around the way we work together. And there is no moment in time in which, like, it is very unusual, right? That every, I think only an alien and an invasion would give the same level of collaborative thing that we're dealing with, that every single country is participating in this, right? So this is a big moment for this unified effort amongst all of us. So that's the beautiful thing. I think that on the other side of it, like you said, viruses really do both expose and exploit cracks in our society, and justice being a very big one. And ultimately, human beings have a really hard time working together just at the office on a regular day. Add to it an insidious, deadly threat, and essentially outbreaks become a crucible of paranoia, suspicion, fear, of perverse incentives to make money. So there's a lot there. I worked with a journalist, Lara Salahi, after the Ebola outbreak, to kind of give some voice to this. And we ended up writing a book called Outbreak Culture. And it was this toxic culture that forms in this real crucible of insanity that we're dealing with, in the chaos. And it just talks through all the things, like anticipates all the stuff we saw here, where we see fights between individuals or countries hoarding, or or other events happening with the tension that's rising in this episode. It was kind of incidents, and ultimately you can overcome it, but it has to be a deliberate choice, where we always have to make a deliberate choice to go to the better angels of ourselves, to create a meritocracy, a transparency, a process, looking out for the most vulnerable amongst us, because again, they're in with us in this, and if we don't help them, it will come back to us. So it's one of these things where it shows us what's possible, but that one of the biggest challenges getting there is working collectively and really in partnership.
Is there something is there a concrete example of one thing, maybe even just where either of you thinks, if we look at that, if we change that one thing, like that will already help us a ton going forward?
I think what Pardis mentioned is this collaboration spirit. It's very important. On the one hand, such crises always cause suffering anyway, but a lot of trouble. If you read Camus' La Peste, it tells you, I mean, that the mechanisms are very clear. Or there was in the 14th century, there were in Strasbourg on Valentine's Day, 2,000 Jews were killed because people thought they had poisoned the wells when the pestilence arrived. So you have these things happening. On the other hand, what I personally observe, I observe it in my own company. I observe it within governments, among different companies, collaboration with academia. We understand that we can tackle this only together. And I see an unprecedented sense of togetherness. And I feel, for instance, in my company, when I talk to my co-workers, my colleagues, this sense of purpose, that people understand that we are needed right now. That creates so much positive energy. And I just have this maybe naive hope that we will be able to preserve this spirit in future.
The optimist in you. Do we also need to think about how science works internationally? Like, do we need new funding? Do we need new forms of publishing, some of which we've already seen with studies coming out? Is that also something we need to tackle?
Absolutely. Yeah. I think, on the last section, Anne was talking about like changes to the regulatory process. I think it's true that a lot of that will have to change, of just the way we collaborate, the way we share data, the way we provide recognition for people who do different parts of the exercise, and importantly, the way we patent. We saw during the Ebola outbreak that there's a lot of these sort of countries hoarding their samples. Brazil, for example, has a process of viral sovereignty, the idea that the virus is a natural resource of the country. And you can't have that mindset during an outbreak. But I also understand why it happens, because a lot of times during outbreaks, people swoop in, they parachute in, they get samples, they go and make a product, and it never comes back to the country. And so we have to, it's a hard process where we really have to think, how do we align incentives so that every person succeeds? We can't just say, oh, everybody collaborate. You have to show that altruism and collaboration is actually not just the right choice and the ethically correct choice, it's actually the best choice. And there's so many ways that outbreaks show that the more altruistic you are, the better off you are. I have a paper right now that shows that there's a lot of businesses and schools decided to test only themselves. And it's crazy, like when we ran the simulations, that is like the worst thing to do, of just testing yourself. You have a certain number of tests that you want to actually test everybody around you, so you create a barrier of protection. So it's testing your community is not only the right thing to do and supporting them, it's actually the best way to keep you safe. And I think that's just one good example of how can we get things to line up so that the way we do practice is the most ethical, but also the most effective altogether.
Thank you so much. Can you hear me? Thank you so much.
Yeah.
I have to tell
Suddenly
you,
Steffi is already at the table.
your conversation makes me realize how happy I should be. Your conversation made my day, my work. I'm so happy about it. For me, it was an enlightening talk. It was really, I could hear you. Can you understand this audience? Wasn't it amazing? It's so much more than just a talk about healthcare. It's a philosophical talk. It's about our society, the future of our societies. It's a talk about enlightenment. What's next in our society? What's next? Who are the scientists? What is the driving force of the three of you? Thank you for this. I'm touched about the deepness. Pardis, we have to continue. Stefan, of course, and Sara, I'm blessed with your talk. Thank you.
Thank you.
Thank you, Stefan.
Thanks a lot.
Good. See you soon again.